this video we are going to start part 2 of abnormal labor. So here we are going to discuss mainly about abnormalities in second stage of labor. So second stage of labor abnormalities are divided into two types. One is called as prolonged second stage and the other one is called as second stage arrest or obstructed labor. So second stage arrest or obstructed labor, same name. So first what we need to see is there is no descent of head with adequate contractions. Here in the abnormalities of second stage, the adequate contractions are present in the uterus but head is still not coming out. Okay, so here prolonged second stage can be seen in the primigravida greater than 2 hours, primigravida greater than 2 hours, and in multigravida it is seen greater than 1 hour. Whereas coming to second stage arrest or obstructed labor, here the primigravida the time is greater than 3 hours, still there is no labor, and multigravida greater than 2 hours, still no head is coming out. Okay, so if epidural is given, 1 hour is additional to cutoff values for prolonged second stage and second stage arrest. Okay, for this, for example, in primigravida it will take 3 hours if you give epidural anesthesia. Okay, so coming to prolonged second stage. The prolonged second stage, look at the station of fetal head. First you need to see the station of fetal head. Okay, so if it is above +2, do cesarean section. Okay, and if it is +2 and below it, then do instrumental delivery. Here we need to do instrumental delivery because already some part of head has come out, so just use vacuum or forceps to drag the fetus out. But in the case of station at +2, as still it is inside only, do the C-section. Okay, so coming to second stage of arrest, here always you need to do only cesarean section. Okay, always cesarean section in second stage arrest or obstructed labor. Now coming to obstructed labor, let us discuss it in somewhat detail. Obstructed labor. So obstructed labor, the general examination which you see in the mother is, mother will get dehydrated. Okay, mother is already exhausted because she is trying from lot of time to deliver the baby but not. So she will also have tachycardia, she will also have tachypnea. Okay, so coming to on per abdomen examination, you will see that the upper uterine segment is thick and tonically contracted. So let me draw it. This is the upper uterine segment, so it is contracted like this, whereas the lower uterine segment is thin. Okay, lower uterine segment is thin and stretched, and the depression groove is visible between the upper and the lower uterine segments. So you can see here, for example, this is the upper uterine segment, this is a lower uterine segment, and between the upper and lower uterine segment you can see a groove like structure is forming, and that is nothing but forming a Bandel's ring. Okay, so let me show that in a real diagram. Here I think you can see this is the Bandel's ring, this is the upper uterine segment, and this is the lower uterine segment. In between you can see the ring like structure, Bandel's ring. And remember, fetal distress is also present and suprapubic bulge is present. Why suprapubic bulge is present? Because as the bladder is compressed between the fetal head. Now the bladder of the mother is compressed between fetal head and pubic symphysis. So because of this, you can understand there is suprapubic bulge in the mother. Okay, so now coming to on per vaginal examination, if you do per vaginal examination, you will see that hot and dry, vagina is very hot and dry, and you will see caput presentation and molding is present, and hematuria also may be present. So these are all you can see in per vaginal examination. I am repeating again: hot and dry vagina, caput presentation, molding present, hematuria may be present. So what is the management? Always do cesarean section here. Never give oxytocin. If it is given, it can cause uterine rupture because already here there is a suprapubic bulge, there is lot of pressure on uterus, so now we should never give oxytocin in this case. So what are the complications like? The main complication is rupture of uterus, and also there will be vesicovaginal fistula. What is this vesicovaginal fistula? In short, you will call it as VVF. That is, after 7 to 10 days, patient complain leaking of urine from vagina. So urine is leaking from vagina. Okay, so most common cause of VVF is in developed countries is surgery. There is hysterectomy in developed countries like US. Okay, there the reason is hysterectomy. Okay, coming to most common cause of VVF in developing countries like India is obstructed labor. So obstructed labor. So in both conditions, actually the problem is the uterine cavity is getting ruptured, so there is leak of urine from vagina. Okay, so earlier for obstructed labor with dead babies, the management is craniotomy. Earlier we used to do craniotomy, that is cut the dead baby's head which has come out from the uterus, but now we don't do any such procedures. Now management is just cesarean section. Even if the baby is dead, then you will do cesarean section, you will not do that cutting or like that. Okay, so now coming to Badal ring and constriction ring differentiation. Okay, so Bandal ring versus constriction ring. Let us see what is the differentiation between them. Okay, so bandal ring is mainly due to obstructed labor. Constriction ring is due to injudicious use of oxytocin. Like oxytocin is used in a improper way, so it is leading to uncoordinated contraction. Okay, and the site and position of bandal ring is between upper and lower uterine segments, right? So the position keeps on changing, and here the constriction ring is anywhere on the uterus, position does not change, anywhere on uterus. Okay, and next coming to here, only it is seen in second stage of labor. It is seen in any stage, and here it is seen pre-abdominally, and here it is can be seen, can only be felt. Here it is only be felt, here it can be seen also. For abdominal you can see bandal ring, this constriction ring you can't see, just you can feel that ring. Okay, and next coming to here, there is maternal and fetal distress. Both maternal and fetal distress is seen in bandal ring, whereas constriction ring you can see no distress here. Next coming to fetal parts are not palpable. Here fetal palps are felt. Here you do cesarean section. Here you will do sedation or general anesthesia, or you will give amyl nitrate inhalation. Okay, so this is the difference which you need to find out. Now coming to case 1, let us see one case, you'll understand. So there's a female who is admitted. Of course this cases I think we can discuss later. Okay, so by this we completed our discussion on abnormal labor. Next we'll start mechanism of labor.